In the last episode, we discussed about obsessive-compulsive disorder and what it means. But obsessive-compulsive disorder was not always OCD. The term OCD is a modern medical term from the 20th century. Before, people with OCD were thought to have a condition called scrupulosity. The earliest records of scrupulosity or OCD date back to religious texts, not medical records from the 14th through the 18th centuries. At that time, most OCD features were centered around obsessions and compulsions about religious beliefs and practices. Towards the end of 18th century and going into the 19th century, clinicians started to note that the patient's obsessive thoughts began to center around fears of biological contamination and aggressive and distressing sexual thoughts. The condition came to limelight with Freud's patient, Mr. Ernst Lanzer, who came to be known as the Rat Man because of his irrational fear that rats will enter the body of his father and girlfriend. To cope with this fear, Lanzer engaged in compulsions, namely counting and praying. Freud diagnosed the case as obsessional neurosis and employed psychoanalysis as treatment modality. In the 1960s and 70s, talk therapy was still the most common treatment option for OCD. Today, OCD is mostly treated with a combination of cognitive behavior therapy or CBT and medications like SSRIs. So let's list the treatment options available for OCD. First is medicines. Today, SSRIs or selective serotonin reuptake inhibitors are the first-line treatment for obsessive-compulsive disorder because those are mostly safe and effective. Even though FDA has approved only a handful of medicines for OCD, clinical experience has given us a wide array of safe and effective drugs. But as with all conditions, it takes a while to figure out what will work best if an individual and in what dose. Even though some medicines are used to treat depressive and anxiety disorders, it is well known in psychiatric circles that doses required for treatment of OCD are generally higher. Other medicines like clomipramine or TCA or tricyclic antidepressant is considered a gold standard for OCD treatment, but is not used as first-line drug due to side effects. One may need to use a combination of different psychotropic drugs to treat individual symptoms, and as a clinician, we try to keep up with the latest research to find the best possible treatment options. Next is CBT. Depending upon the severity of OCD symptoms, one may be advised to go for psychotherapy, especially cognitive behavior therapy, as a standalone treatment or in combination with medicines. In our clinical experience, a combination works best for symptomatic treatment as well as long-term recovery. One of the common modality employed is called ERP or exposure and response prevention, where a person is made to face his or her fears in the safe space of the therapist's chamber. CBT is time-consuming and costly, but evidence is in favor for better outcome. Third is DBS or deep brain stimulation. DBS involves implanting electrodes within the certain areas of brain. These electrodes produce electrical impulses that may help regulate abnormal impulses. It is approved treatment in OCD for patients above 18 years of age who do not respond to conventional treatment. RTMS, transcranial magnetic stimulation. It's a non-invasive procedure that uses magnetic fields to stimulate nerve cells in the brain to improve symptoms of OCD. During a TMS session, an electromagnetic coil is placed around the scalp, which produces magnetic impulses that stimulates nerve cells in the brain. Finally, surgery. Brain surgery has been employed as the last resort for certain patients with debilitating symptoms which don't respond and associated with severe distress becomes unbearable. It is not a common procedure and very few surgeons conduct the procedure. Alternative therapy options. In my discussions with alternative treatment modalities, no specific effective treatment option has been reported. Since OCD symptoms escalate with stress, practices that manage stress like yoga and breathing exercises are recommended. Unguided meditation carries the risk of increasing obsessive ruminations or feeling like one is stuck in a loop. From the perspective of diet and nutrients, some studies have shown augmenting effect of zinc and magnesium supplements along with traditional vitamin D, vitamin B12 and folic acid. Acupuncture has also been studied. Music therapy may be effective for anxiety and compulsive mental acts, but there is no published research. None of these modalities currently are seen as alternative to known psychiatric and psychotherapeutic intervention, but may be used to complement the ongoing treatments. In summary, there is no known preventive intervention for OCD except early diagnosis and treatment. Considering the debilitating impact of OCD on patients, awareness and acceptance are the only available options to start intervention early. Unlike other psychological issues, individuals suffering from OCD have the understanding that their thoughts are unnecessary and cause distress, but they are unable to control them. Criticism, judgment, and insults by people in the environment make it even more difficult to deal with these problems. Secondary depression and suicidal thoughts are thus common as helplessness sets in and may cause fatal outcomes. Available treatment options are quite effective and help in avoiding potential deterioration and development of resistance. So if there is someone out there who is repeatedly thinking of the same things or doing same things which are beyond one's control or comprehension, do talk to a mental health professional. If you like the information on our channel, please like, share and subscribe to Manasthali, where mind meets matter. Till next time, see you.